This year, NHS England wanted to hear from charities that had involved service users to inform and enhance their healthcare provision. We felt this would be a great opportunity to showcase some of the work that Young Epilepsy has done with children and young people with epilepsy as part of its Darzi Fellowship, in collaboration with the Institute of Child Health, UCL Partners and Whittington Health. Young Epilepsy received a Celebrating Participation in Healthcare grant from NHS England, who wanted to hear from some of our service users. We asked them to tell the story of how they have worked with us over the last year. They didn't let us down. They amazed us with their range of artistic talents and creativity, and worked together to produce a film that not only describes their experiences, but also gives a voice to their opinions. We held workshops and animation classes to bring people together and invited them to share their experiences with us. The final film is a collaboration of over 30 children and young people who gave up their time to share their stories. This is what they had to say.
This is a story about how young people with epilepsy are helping to change the way our care happens. It all started because lots of people said that services for children and young people with epilepsy like me aren't good enough, but no one knew exactly why. Young Epilepsy had been talking with their partners and thought, we know. We'll ask the young people and their parents what they think. They wanted to know what our thoughts were and what our experiences had been. So they talked to us, sometimes in groups, sometimes individually, and also with some questionnaires. They really wanted to know what we thought the problems were, things to improve, and what improvements would help us. We had lots and lots and lots to say, and they listened. We said that we thought the system was really complicated, that communication could be a lot easier, that everyone in hospitals, schools, or wherever needed to know about us and our epilepsy, that we are all different, and our epilepsy affects us in lots of different ways, and it isn't just whether we have seizures or not, and that we wanted the chance to be heard more. Together we came up with what good care should look like. All the professionals need to work better together and communicate well. They need to think about the things that matter to us, and we need to be at the centre. Then they wrote it all down and put it in a report. The report said what things needed to be done to make our care better. Lots of important people read it. It became important both locally and nationally. It was even discussed in Parliament. So now they are working on making those things happen with lots of different projects, like helping us create networks of young people with epilepsy so that we can keep on having our say about what matters to us.